And we decide right then and there that we have to do this story, that we've stumbled across potentially one of the most consequential AI experiments of the past few years.
So they were okay to have a model that overcharges the poorest and undercharges the richest. You understand?
Kenya, over the past few years, has been in the middle of a gigantic overhaul of its healthcare system. One of the things that I spend way too much time doing is going around to different journalism conferences and giving workshops about how journalists can investigate AI. I'm at Data Harvest, which is like this nerdy data journalism conference in the city of Mechelen, like freezing cold. And I'm giving this workshop. Most of the people in the audience are European journalists, but when I finish this workshop, a Kenyan journalist comes up to me. She introduces herself. She says, my name's Mukami. I'm a statistician who sort of moonlights as a journalist.
So after the session, I let everyone else ask them the questions. Everyone. I just sat still. And then when everyone had left is when I went to speak to them.
And she tells me that one night when sort of working on some other things, she overhears this discussion in Parliament, on like the live stream of Kenyan Parliament.
You see the way people like putting on some music or some radio or some podcast? Myself, I would put these Parliament discussions.
And they're discussing this algorithm that uses things like whether your house is made of dun or corrugated iron in order to predict how much money you make. And to use that prediction then, determine how much money you should sort of contribute to the healthcare system.
This conversation reminded me of a story I had read about 2 weeks before then, about this team of journalists who had worked on this risk scoring algorithm that was being applied on Rotterdam residents.
But I am kind of like skeptical of this idea. Like that seems so absurd to me.
I was shocked that it's already in Kenya that immediately.
The conference ends and like I kind of forget about it until six or 7 months later.
There was the AIJC Africa Investigative Journalism Conference, and Gabriel is there.
And Purity is there as well. And she sort of pulls us aside and she's done a lot more research on the system and she's sort of telling us about it and it piques my interest.
Because I kept asking him, are you really going to help me figure this out?
So I go back to my hotel room that night and I start doing some Googling and I realize that everything Purity has told me is true. And we decide right then and there that we have to do this story. Kenya, over the past few years, has been in the middle of a gigantic overhaul of its healthcare system. In the old system, if you wanted to access public healthcare, everyone sort of paid a flat rate. But at the core of this reform is that households in Kenya should pay an annual fee to access public healthcare that is proportional to how much money they actually make. The problem with that is that 80% of Kenyans work in the informal economy. And that means that the government has no sort of formal tax or income records. They have no idea how much money that people make. So how do you charge people a healthcare fee that's proportional to their wealth if you don't know how much money they make? And so what the government decided was to implement an algorithm that predicts how much money each household in Kenya makes and then charge them an annual healthcare contribution that's proportional to that.
So when they kept promising about this new system that's going to be great for everyone and affordable for everyone, even me, I wanted a system that worked. When I realized they're using an algorithm and I'm a statistician, I really wanted to be sure it's not going to be biased like the one I had read about from Gabriel's previous story.
This story is really important, that Kenya is at the forefront of this global trend where governments are experimenting with AI and using it to make life-changing decisions about people. So we started looking at social media and found dozens and then hundreds of posts and comments from people complaining about how they are being charged healthcare premiums far higher than what they used to pay. Purity comes to Athens for a few weeks, is working out of the Lighthouse office. We call this our boot camp.
So I remember this day on that big table in Lighthouse office.
I'm sitting there with Purity and she makes this huge discovery, which is that the training data set for this algorithm is just lying there on this government website. And I've never heard of that happening.
And we click submit, and voila, the data is right there in front of us.
I remember she just gets so excited, and we have this whiteboard in the office, and we're literally scribbling. She's scribbling equations on the whiteboard, like trying to figure out how this model works. And I mean, it was a huge gift. I mean, Purity has a master's degree in statistics. We're like looking at the statistical model, and I have someone there in the room with me who has a master's degree in statistics. Like, I mean, what more could I ask for?
They had nicely put the formula, and we have suddenly gotten the training data set. So we have everything.
Obtaining this training data was a game changer because we knew that if we just got a little bit more information about how they designed this system, we could reconstruct it using their own original training data set. We get the variables the model uses, and we get the formula. And what that allows us to do is to actually reconstruct this means testing model and test it against data we have to understand whether it is accurately calculating people's healthcare premiums. And when we do that, what we start to understand is that this model overcharges the poorest Kenyans while undercharging the richest Kenyans. Even more so that it struggles to reckon with the complex reality of poverty on the ground in Kenya.
If you go to the poorest group, the model would overcharge 80% of the people on the poorest group, and it will undercharge 60% of the people in the richest group.
Something as simple as just having electricity can mean that a poor household is predicted to be actually a rich household. Insiders who are familiar with discussions around this tool tell us that those involved understood that these trade-offs were there, that these flaws were inherent in this means testing approach, but decided to press forward anyway.
So to know that before they launched the program, they knew that the program will be this unfair to poor people, and they preferred it to have like such error. To know that they knew that was the case was like more disappointing for me.
Purity is this person who's incredibly talented, the sort of interest in stats and data, going up against, you know, the government of Kenya, and getting to the bottom of this system that is affecting the lives of millions of people in the country. And this system is just the start. I mean, the government is rolling out these same types of algorithms in the education sector, in the social safety net, and to determine, even to calculate income taxes.
We have many, many more models to look into, and I am more equipped and more confident to work with other colleagues from Kenya to hold them accountable for these many models that they've decided to use in all sorts of sectors.
Something really crazy to think that this whole investigation started with Purity paying her own way to Mechelen, Belgium, and approaching me at the end of a session there.
AI and machine learning systems that are now making various decisions for ordinary citizens, ordinary Kenyans. It is necessary for them to start to understand how to question such systems. It shouldn't be a tech bro kind of conversation only anymore.